I want to welcome everybody who is joining this important forum on maternal health. I am Eileen Elias, and I am with the League of Women Voters of Cape Cod. In partnership with the League of Women Voters of Massachusetts, Jen Muroff, we are so pleased that this forum is being provided this evening to the Cape Cod community, and I believe also throughout the Commonwealth. In that regard, we have some excellent, as you will hear, panelists who will each be presenting from their particular positions on why this meeting or forum is so important. What, in fact, is going to occur that by 7:30, you will have had the opportunity to hear from the 6 panelists. You will hear from other key people that I will shortly identify. And as important, be able, as we can, have your questions answered towards the latter part of the forum. If we do not get to your questions this evening, we will have them in the chat box, and we'll be able to then respond through follow-up email. And I thank you. I particularly want to acknowledge the participation by 2 important legal or elected officials, Senator Miranda and Senator Sear, each of whom will be with us this evening and were key, especially thank you to Senator Miranda with Senator Sear's support in getting this important maternal health bill into law signed by our governor. Thank you also to Emily Anesta. I am not sure if she's on the forum. She is with the Bay State Birth Coalition. She truly helped me in planning and carrying out today's forum. Thank you to each of the panelists' organizations, Cape Cod Healthcare, the Massachusetts Department of Public Health, By Your Side Doula, Boston Neighborhood Health Center, and the Outer Cape Health Services. You will hear from these organizations' panelists. The League of Women Voters' role in providing this forum, as I said earlier, is in partnership with the League of Women Voters of Massachusetts. Please use the webinar's chat box when the forum question and answer process begins to place any questions you may have. Know that if you need interpretation support, that you can turn on the subtitles in any language on the Zoom's YouTube. As identified, as you saw, the forum is being recorded, and it will be posted on the League of Women Voters Massachusetts YouTube channel and the League of Massachusetts Cape Cod website, as well as on our website for the Cape Cod chapter. Recognize that you will be hearing from panelists who are impressive and exemplary as healthcare professionals who represent administrators, policy experts, healthcare, and advocate providers. I also want to thank Dr. Siddhartha, who I noticed is participating in bringing on one of our key panelists, Dr. Agel. And so that's just one more example of the partnerships that we've had to having this forum this evening. With that, I am honored to introduce Senator Sear, who will be making additional remarks of introduction, and then followed by Suzanne Brock, who will facilitate the panel presentations. Following the panel presentations, as said earlier, There will be time for question and answer, and that Q&A will be managed by Sue Cameron. Senator Sear, thank you.
Thank you, Eileen, and a big thank you to the League of Women Voters of Cape Cod for pulling this together. I'm so thrilled that we're having this conversation tonight because it represents a tremendous amount of work, yes, over the last session, but over many, many years to really close very significant gaps in health equity and morbidity and mortality that we see for in maternal health, particularly for Black mothers and other mothers of color. I'm thrilled that y'all are going to be hearing from my colleague, Senator Liz Miranda. Liz is no stranger to Cape Cod, so she represents Roxbury in Boston, but she spends quite a bit of time in Falmouth, and she was one of the tenacious leaders in really ensuring that we took action last session to get this done. I also want to recognize, I'm the Senate chair of the Joint Committee on Public Health, and I had the honor of working on this legislation with my co-chair, Representative Marjorie Decker, in the House, who is also tenacious and fearless and really pushed to get action on this bill. We got out of committee in a timely fashion. The House took this up, and then the Senate also did. My colleague, Senator Friedman, also played a large role in working with Senator Miranda to get this negotiated with a number of colleagues. So you're going to hear tonight what this bill does around expanding access to midwifery, to doula services, address help for birth centers, and a whole host of other policies that have been long overdue. I'm really proud to have played a small role as the chair of the Public Health Committee in making sure that we got this done. And I think it's really incumbent upon us now more than ever to be vigilant for the very persistent health inequities that we see across our Commonwealth, and especially close to home right here on Cape Cod. This is a trying and difficult and uncertain time. I think we're quite worried about our ability to sustain a whole host of essential public health work given events in Washington. But this Momnibus bill really represents a really crucial, important step forward. So thrilled to be with you tonight. I'm thrilled you're going to hear from Liz Miranda, and just really grateful to the League for convening such an important conversation. Thank you.
Thank you, Senator Sear. And your comments are most appreciated. I believe Senator Miranda has joined us.
Eileen, I don't believe. Oh, great. Wonderful.
I thought you were there. Thank you. It's good to see you. And thank you.
I'm not sure if I'm on the agenda or Susan is. I don't want to take your spot.
You are
Susan.
on the agenda. Go.
All right, great. Well, thank you all this evening, and thanks to my good friend, the gentleman from P-Town. I do spend a lot of time in Falmouth. My mom, if anybody lives in Falmouth, my mom lives on Old Meeting House Road. I went to Falmouth High and Upper Cape for a year. So it holds a special place in my heart since the 80s. And I've really valued the experience that I've had growing up in the inner city, coupled with being able to spend time in such a beautiful place as the Cape and Islands. I do want to uplift and thank my dear friend and ally in the work, Jen Mira, for ensuring I could make this evening possible. For so long now, and for all these years, Jen has been a partner, and I don't want to call it partner in crime because we haven't done anything illegal on so many issues, but we've been working hand in hand, and I'm just grateful to you. So thank you, Jen. And also to the whole League of Women Voters across chapters. You all have been such an incredible group of advocates, scholars, sisters of mine throughout my time, both in the House and the Senate. I had to join you tonight to celebrate this monumental and historic passage of the Maternal Health Omnibus Bill, which, you know, my dear friend Sear wasn't in the best shape at the beginning of the year, but really his work and his hands and his staff really helped to package it in a package that could be actually signed into law, which it was. And because of this, I would be remiss if I don't spend some time talking about the chairman of the Public Health Committee. And I want you guys to know that in his capacity, his team and himself, he worked with me and my team for so many hours over the past a year and a half to actually make sure that this could reach the finish line. So I want to thank him dearly. And you guys have someone really, really good in the Senate and someone I've learned a lot from. I've been leading on birth justice and on this bill for nearly 6 years. And when people talk about government being slow, they're not lying. I began in the House with passing legislation, which was a commission. And that commission was focused on reducing racial inequities and maternal health outcomes. And that commission was 96% women and providers of color to specifically look at the issue of Black maternal health, because maternal morbidity and mortality had higher rates in immigrants, people in rural communities, and women of color. And we went across the Commonwealth, basically speaking to people and finding out why was the state with the best colleges, biotech, life sciences, public health infrastructure, and hospitals, still there were women and our children dying and birthing people. And what we found, it wasn't an easy task. There were many bumps. But through these initiatives and institutes and hearing from providers and regular everyday people, and there was a lot of pain and trauma that arose from studying maternal health and the crisis we have in the Commonwealth. For some people, they just didn't understand. And it wouldn't have been possible without the leadership of those women who shared their stories, that shaped the policy recommendations tied with best practice and lived experiences. So following this process, just for those of you that don't know, in the House, we quickly began working on redistricting in the legislature. And I learned at that moment that my state senator, Sonia Chang Diaz, was going to run for governor, but also her district was going to have a redrawn district that would include more equitable representation through communities that of shared interest in one state Senate district. Those included the neighborhoods that I'm from, Roxbury and Dorchester, but also included Mattapan, Hyde Park, Jamaica Plain, Mission Hill, South End, Rosendale, and the Fenway. And the bulk of the district was my lifelong home, which included Blue Hill Avenue from the top of Roxbury all the way to Mattapan. It was in that moment that I knew that I had to run for the Senate to represent a community I grew up in and that I fought for decades before public office. So after an intense race, we won. We headed to the state Senate and brought the work with us, filing an act relative to birth justice, which was a comprehensive bill, which included some provisions that I'd like to talk about as I close my remarks. One of the groups of people that I didn't talk about a lot that really inspired me is that there was a maternal health caucus at the federal level with our Congresswoman Ayanna Pressley and a lot of other fabulous Congress people. And they created a bill called the Momnibus bill that had 12 to 14 small pieces of legislation that we took along with the 137 recommendations that came out of the report, that came out of the commission, that was voted unanimously by the House and Senate in 2021. One of the biggest points in the bill that I'm super proud of is a universal postpartum home visiting program. When many families are harmed or go into psychosis or challenging times arise medically, physically, and emotionally, oftentimes it happens in the postpartum period. I'm not lucky enough to be a mom yet, but I've gone through the postpartum period with both of my siblings. And actually, my sister Christina was the reason why I began this work, as she gave birth to a baby at 21 weeks that did not survive because her doctor told her that she was anxious and she should go home and take a nap and take some Tylenol. And she went into early labor. And that experience of losing Mila led me to come to the State House to learn more about the devastating impact of infant and pregnancy loss, and also for women who are going through this process. So this universal postpartum program actually codifies Medicaid coverage of doula services. Postpartum home visiting program, the codifying of Medicaid coverage of doula services, and establishing a system to license midwives and expanding free birth centers across the Commonwealth were really, really important to the bill. A couple other pieces that were important was to diversify the perinatal mental health workforce, to strengthen prenatal screenings, bolster out-of-hospital delivery options for our residents, and strengthening oversight for ultrasound services. And recently we've seen progress with the implementation with the FY26 budget and House 1, which is the governor's bill. It states that Mass Health enrolled over 150 doulas. This is just a few months ago. To see something get signed into law and then see that 150 doulas have already signed up, and it's provided doula coverage to over 1,000 Mass Health members within the first year. While Mass Health's coverage of doula services is laudable, the number of eligible members served by doulas could be improved because we do not have private insurance coverage at this time. And 1,000 Mass Health members represent less than 4% of the 27,000 Mass Health members who gave birth in 2022. That's the year that we have the last amount of data, and it's probably larger in 2024. Not to mention the many thousands more who did not give birth in 2024, but were eligible for doula service because they were pregnant or in the 12-month postpartum period. This relatively low uptake most likely reflects not just the time it takes to implement a new program, but also the significant work that must be done to address the doula workforce shortage. Although we're happy that 150 new doulas, there's not nearly enough doulas in the Commonwealth, and to build the trust that we need between Mass Health and the workforce to ensure that doulas can afford to take Mass Health clients. And we've seen a lot of progress in birth center regulation. I'm hopeful that we will build the first in a while birth center in Eastern Massachusetts, hopefully in my district in 2025 or 2026. And so we're so excited to keep working together on this. And I just want to thank the League and all of you for inviting me to speak about just a few of the things that I'm really proud of. And I just want to say this last thing to the League. This bill was supported by your organization, and I think it had all to do with why it crossed the finish line in the timeline that it did. Oftentimes when you're thinking about working on policy issues, particularly policy issues that impact women and those that identify as such, we have to work together to ensure that we're actually representative of all women. When I started working on the Black maternal health crisis, I used to tell people that if we improve outcomes for those that are most vulnerable, we actually will improve outcomes for everybody. And that's what I feel like we've done. So thank you all for inviting me today. I can talk about this issue for a long time. So you can email me and call me, of course, with Julian, if I can have some of your friends up there on the Cape, if you want to talk more. But it's just an honor to be here tonight to talk about something that I'm so proud of that's going to save lives.
Thank you, Senator Miranda. That was wonderful. And we are honored. And with that, I would like to introduce Suzanne Brock, who will be facilitating the panel discussion. And Suzanne, I turn the baton to you. Thank you.
Thank you, Eileen. I just want to welcome everyone again and thank all the panelists for being present. The panelists for tonight's forum will be discussing features and impacts of the new maternal health law from their unique areas of expertise and perspective. Each panelist will have no more than 7 minutes for their remarks. At about the 6-minute mark, I'll kind of break in and indicate that you have another minute to go in case that you haven't finished your remarks. For those viewers attending the forum, we will be handling the questions through the chat option. So please choose the meeting group chat so that our screeners can more easily find your questions. And try to hold off submitting your questions until the panelists have finished their remarks, because someone in the group might end up answering your question in their own comments. With that, for directions, I would like to introduce our next speaker, Dr. Jop, who is the Assistant Commissioner for Health Equity at the Massachusetts Department of Public Health. Dr. Jop.
Thank you so much for having me today. Good evening, everyone. I am Dr. Fifi Jop. I serve as the Assistant Commissioner for Health Equity at the Mass DPH. I was honored to be standing next to the governor as she signed the bill into law. It was a powerful moment that reaffirmed our collective commitment to advancing health and racial equity in Massachusetts. This legislation is more than just a policy. It is a tangible step toward dismantling the barriers that have long harmed birthing people, Black birthing people, and other historically marginalized communities. For the past several years, DPH has worked with providers through our State Perinatal Neonatal Quality Improvement Network, PINQUIN, state legislators, advocacy groups, including people with lived experiences, March of Dimes, the Mass Medical Society, etc., to develop policies aimed at improving maternal health and eliminating inequities in health outcomes. Globally, public health and medical professionals focus on maternal mortality as an indicator of maternal health and the quality of reproductive health care. While maternal death is a significant and tragic outcome, it is actually considered the tip of the iceberg in terms of adverse maternal outcomes because it accounts for a small proportion of the overall burden of poor maternal health. For every maternal death, there are about 100 episodes of severe maternal morbidity, which we refer to as SMM, affecting more than 50,000 birthing people in the US and about 400 birthing people in Massachusetts every year. So reducing maternal death and SMM was a Healthy People 2010 and 2020 goals and remains one of the goals for Healthy People 2030. However, limited progress has been made in achieving these goals across the country and in Massachusetts. So in July 2023, DPH released a report indicating that the overall prevalence of SMM nearly doubled in Massachusetts from 52.3 per 100,000 in 2011 to 100.4 per 100,000 deliveries in 2020. These statistics mirror what we see at the national level. The data also indicated that Black non-Hispanic birthing people consistently experience the highest rates of labor and delivery complications among all race ethnicity groups. In 2011, the gap between SMM rate for Black, non-Hispanic, and white people was twofold. By 2020, the SMM rate for Black, non-Hispanic was 2.5 times greater than that of white, indicating a 25% increase in the gap over time. These statistics are absolutely unacceptable in a state, as we all know, is a home to one of the best healthcare systems in the country. So in September 2023, Governor Healy instructed Secretary Walsh, Undersecretary Mahania, and Commissioner Goldstein to conduct a review of maternal health services across the Commonwealth and to develop a plan to improve access and quality of care where needed. In response, DPH submitted a report entitled Review of Maternal Health Services in 2023. This report included 25 actionable recommendations, and I'm excited to share that several of those recommendations are now being directly supported by the Momnibus law and include the following. First, expanding access to quality care through universal postpartum home visiting. DPH will expand the Welcome Family program, offering a one-time nurse home visit to all caregivers with newborns statewide. Currently, this program is available only in 5 sites: Boston, Fall River, New Bedford, Lowell, and the Holyoke Springfield area. Second, establishing a licensure pathway for certified professional midwives and lactation consultants, which will allow them to obtain, carry, and administer medication within their clinical scope of practice. Third, revising the regulation for freestanding birth centers, which will potentially allow the establishment of more freestanding birth centers that will operate independently of hospital systems and ensure these centers provide safe, equitable, and accessible birth options. These regulations will make it easier for people to access midwifery care also. DPH already updated the birth center regulations and will be promulgated soon. Fourth, improving insurance coverage and reimbursement for perinatal services. The law requires MassHealth and other health insurance plans to cover doula services, non-invasive prenatal screening, postpartum depression screening and treatment, donor milk for newborn, and universal postpartum home visiting for birthing people up to 12 months postpartum. In addition, the bill ensures equitable reimbursement for certified nurse midwives and addresses barriers to access for marginalized communities. Effective January 1st, MassHealth will provide equitable reimbursement for CNMs. The bill also requires MassHealth to cover for medically necessary pasteurized donor human milk. Finally, addressing maternal mental health and substance use disorder. A new grant program will be established to support initiatives addressing maternal mental health and substance use disorder, particularly in underserved areas. How will OBGYN practitioners implement and administer the maternal health law? The law establishes the Board of Registration in Midwifery within the Department of Public Health to oversee the CPM licensure pathway and to develop practice standards. The board will consist of 9 members appointed by the governor, one of which will be an OBGYN. I'm happy to talk about the activities of the board, but in the interest of time, I'll skip to that. The second way the OBs can contribute is that they can support the Maternal Mortality Review Committee, which reviews maternal death, studies the incidence of pregnancy complications, and makes recommendations to improve outcomes and prevent mortality. The MMRC members include the chair of the Mass chapter of ACOG or their designee and a medical professional with obstetric and neonatal nursing training. The second question is, how does the law address cultural
Dr. Jupp,
equity?
you have a minute left.
Okay, that's good. The question about cultural sensitivity and equity for the Cape Cod communities. The law aims to address inequities in maternal health by providing culturally competent, accessible, individualized care to birthing people and their families. By integrating community birth into the maternal health system, the law seeks to improve high quality care in community settings while allowing for systems for transfer to hospital services when necessary. In the Cape and the island, increasingly lowered access to maternity care may drive families to choose community birth centers. The law enables birth centers to be established in the Cape and integrate home birth within the system of care, improving safety and quality for families in the Cape. In closing, the Momnibus law sets a precedent for what's possible when we center equity in our decision-making and take bold action to ensure that each person has the care, dignity, and support they deserve. The pursuit of equity is more than just a good idea, it's a moral imperative. Advancing equity is fundamental to shaping a public health ecosystem that can lift the health and well-being of our state and its diverse communities. Thank you for having me today.
Thank you very, very much, Dr. Jupp. I would now like to introduce Dr. William Agel, who is the Chief Medical Officer at the Cape Cod Health Care, and he is also a practicing obstetrician and gynecologist here on the Cape. Welcome.
Hi, thanks very much, Susan, and thank you to the League of Women Voters for inviting me to participate in this forum. It's really an honor for me, and I definitely support the work of the League as well as everybody on the call. As Susan said, my name is Bill Agel. I am currently the Chief Medical Officer for Cape Cod Healthcare. As you know, Cape Cod Healthcare comprises Cape Cod Hospital, Falmouth Hospital, as well as all of our affiliates. And we deliver about 1,000 babies a year here at Cape Cod Hospital, which represents probably the majority of those born here in Barnstable County. In addition to my position as a Chief Medical Officer, I've been a practicing obstetrician gynecologist here on the Cape for the last 30 plus years, and have seen a lot of changes. I started the practice in 1999, actually, as partnering with the hospital to provide care to un- and underinsured women. This was prior to the days of universal health care here in Massachusetts. And that practice has grown to encompass essentially all the obstetrical providers on the Cape who deliver at Cape Cod Hospital. So you can imagine that this subject, especially the Momnibus bill, has been dear to my heart. That said, we at CCH welcome the Paternal Health Care Bill, the Momnibus bill, and our providers have been working closely with our administration and specifically with Dr. Kumar Siddhartha, our Chief of Diversity, Equity, and Inclusion here at Cape Cod Healthcare, to be sure that we can implement the law and work within the law in a way that enhances the care we provide to our patients and our community. To that end, Cape Cod Healthcare has had actually an active nurse midwifery program within the hospital since 2008. And that started with 2 nurse midwives and has grown to now six plus full-time equivalents. And we have nurse midwives on our birthing center 24 hours a day, 7 days a week, doing the majority of our deliveries in partnership with our obstetrical physicians. And then our nurse midwives also staff our outpatient shifts in our Hyannis outpatient offices, where they partner with our physicians to provide prenatal care. We would like to expand that, and I think that this bill gives us the opportunity to do so by increasing the numbers and the ability and access to nurse midwives. I'd also like to say that we have partnered with one of our other panelists here, Jody Belson, who works and runs the midwifery program at Outer Cape Health Services. Jody takes care, and as I'm sure you'll hear about, provides prenatal care on the Outer Cape, and then those birthing people are then delivered by our nurse midwives and physicians here in Hyannis. And that partnership has, I think, been a real boon to the folks in the Outer Cape who do not have to travel over an hour to see an obstetrical provider here in Hyannis. In regards to the doula program, I'll be the first to admit that Cape Cod Hospital, like the majority of hospitals in the Commonwealth, has been slow to adopt and embrace the doula program for a variety of reasons. But as we've grown in our inclusion journey, we have recognized the need for these services, particularly among our immigrant community, where culturally competent doulas have the potential to provide a bridge between our local medical culture and the diverse needs of our patient population. To that end, Dr. Siddhartha and I and the remainder of Cape Cod Healthcare have begun the process to recruit, train, and support culturally competent doulas within the community. And Cape Cod Healthcare is funding that training. And finally, we've taken steps to look at our care processes and outcomes through a more inclusive lens, recognizing that different groups, particularly women of color, experience our healthcare system in different ways. And to that end, we've begun to analyze our quality outcomes in maternity care and stratifying our outcomes based on race, ethnicity, language, among other criteria, to look for hidden discrepancies so that we can close any gaps in care. So far, I'm happy to say that it has been, as it pertains to maternity care, we have found fewer differences in outcomes between racial and ethnic groups than would be suggested based on the national data. Our C-section rates and preterm birth rates, for instance, are similar in all groups. But we have identified the incidence of hypertensive disorders in pregnancy to occur at a disproportionately high number of our Black American, Haitian, and Caribbean patients. And currently, we're undertaking a study to assure that all of those patients are receiving all the interventions that are recommended by the American College of Obstetrics and Gynecology. And at that, I think I've probably taken up a significant portion of my time, and I look forward to any of your questions afterwards. Thanks very much.
Thank you very much. Actually, Dr. Agel, you had about a minute left, but we'll catch you in the question period. I would now like to introduce Erin Bray, who is a registered doula, and she works out of By Your Side Doula, serving the Plymouth and Barnstable counties. Erin?
Perfect, thank you. So yes, I'm a birth and postpartum doula. I've been a doula for 7 years. For those that may not know, doulas technically are not medical professionals. We do provide physical, emotional, and educational support to really families during the pregnancy, birth, and postpartum period. So although my main focus is the pregnant person, I really provide support to whoever their support people are. Even sometimes children are part of the setting. Most of my meetings with people are done in their home. And with everybody, you know, if their children are present, we work with that. So it's really a casual setting, really family friendly. Obviously during birth, I attend wherever they are. So whether that's a home birth, a lot of people think of doulas just for home birth, but most of my births are at either Cape Cod Hospital or Beth Israel in Plymouth. And clients have access to me, honestly, through my personal cell. They can call me, they can text me. Some people do a lot of emailing, but they have direct access to me from the time they hire me until well into their postpartum period. Specifically, what this new law means for me, as people have said, now doulas are covered by Mass Health. So anyone that is eligible for my services, they have up to 8 perinatal visits that they can use however they want, whether it's during their pregnancy, so that we're doing those postpartum sort of preparing for the birth type meetings, or they can use them for postpartum. When I do a postpartum visit, we're obviously checking on their well-being, but also answering any questions they might have about the baby, about themselves. I find that a lot of people sometimes feel more comfortable asking me questions that they might not feel comfortable asking their doctor or other provider. And a lot of times that means I'm telling them, like, this is something you really need to call your doctor about. But I've really learned over the years that because of the relationship that I'm building with people, you know, there's a different comfort, less insecurity about some things. But as far as Mass Health covering, you know, all of these services, obviously it opens up a door to people getting those services that wouldn't, you know, wouldn't have been able to afford services before. I have over the years offered discounts or payment plans. So I have previously serviced people that had Mass Health, but at that discounted rate or with the long-term payment plan. So I also feel that by those services being covered by this insurance, it opens the door for people that maybe still have a financial need, don't qualify for Mass Health, but still wouldn't, you know, wouldn't be able to afford my full price. So now I feel that getting, you know, the insurance coverage, I'm able to offer that discount maybe to somebody that doesn't have insurance coverage. So I feel that it's not just benefiting those with Mass Health, it's benefiting, you know, other people as well in the state. And I would think that other doulas would feel the same way, because a lot of doulas really do try and offer discounts, payment plans, sliding scale fees, those sorts of things. But that was all that I had for my time. And I'm looking forward to hearing the rest of the speakers. I think everybody has been wonderful. I'm learning some different things from each person. So thank you all.
Thank you very much, Erin. And I have to say that doulas didn't exist when I had my 2 children, and it would have been great to be able to experience that kind of help. But I would next like to introduce Catherine Rushforth. She is a certified nurse midwife, working as the policy director out of the Boston Neighborhood Health Center.
I just corrected, Neighborhood Birth Center.
I'm sorry, Neighborhood Birth Center.
Hi, everybody. I'm so thrilled to be here tonight. Yeah, my name's Catherine. I use the she, her pronouns. I am I'm a certified nurse midwife, and I'm the policy director for Neighborhood Birth Center, which is a nonprofit working to open Boston's first freestanding birth center. And we have been at this trying to open a birth center in Boston for about 10 years. I came on 3 years ago, and it just became very clear that many of the barriers to open and sustainability of birth centers, that we were going to really need systems level change. And so Neighborhood Birth Center, along with the Bay State Birth Coalition, the mass affiliate of the American College of Nurse Midwives, and the mass affiliate of the Certified Professional Midwives, really were lead advocates, like living at the State House. I mean, the number of hours we spent with Senator Miranda's team, with Senator Sears' team, with Rep. Decker's team, getting this bill through. Part of why we had to get really involved is Massachusetts, as Dr. Diop has said, Massachusetts was having really unacceptably terrible maternal health outcomes given the resources in this state. This includes 11 maternity care closures, including 2 birth centers. So at this point, there's only 1 operating birth center in the entire state, and that's in Western Mass. Massachusetts had also ranked 32nd in the nation for integration of midwives. So basically how well midwives were working in the system. And that marginalization and undervaluing of midwives impacts every perinatal measure negatively. Midwifery care, and particularly birth center care, have the best outcomes, hands down. We have birth center care as a 40% reduction of cesarean section, a 26% reduction of preterm birth, much improved patient experiences, and it saves the health system millions of dollars. So what was so powerful about this maternal health bill is that so much of it was really around at the midwifery care was such a huge part of this bill. And the things that Dr. Diop already reviewed, that licensure of certified professional midwife, which is a different credential than what Jody and I have, but are midwives who are real experts in out-of-hospital birth. We're getting nurse midwives reimbursed fairly. We were getting 85 cents to the dollar to physicians for the same exact service. And I don't need to tell this group the gender dynamics of that. The birth center regulations have just been revised by the Department of Public Health, and now they're amongst the best in the nation. So what I want to finish on is a video that Neighborhood Birth Center created around the vision of birth center care, because birth centers aren't terribly well understood. So I want to give you a sense of this, because this birth center, obviously we're focused in Boston, but we actually now have the ability to scale birth centers in a way that's never been possible. So hopefully my tech will work, and I will share my screen and you can all watch this video.
Can I hear my birth story? Of course, my love. I found out I was pregnant in the fall, just as the trees were shedding their leaves. Like the trees in nature herself, we began preparing for a new season with so much joy and excitement, readying our home, our community, and dreaming of your arrival. But you have to understand, little one, that back in 2022, many of us were still afraid to give birth. All I ever heard was how much it hurt. And the healthcare system was so broken. I saw the worrying headlines about birth outcomes in the US, and the stats were especially bad for Black people. My prenatal appointments felt rushed, and there wasn't time for my questions and ideas for your birth. I longed for something different. After each appointment, I went on long walks to breathe and return to my joy and the initial spark I felt when I first learned of you. One day, a friendly doula handed me a flyer for the opening of a neighborhood birth center, a birth option providing care differently for the many folks who can give birth safely outside the hospital. Neighborhood birth center's grand opening began with honoring the land, the elders, midwives, and leaders in the community who sowed the seeds and nurtured them. Then they thanked the many community members who helped the birth center open its doors. They spoke of how our bodies carry the trauma of the past and how pregnancy is a unique time to heal, how healing care can ripple across generations, how birth center care is safe and produces better outcomes, how this care was intentionally nested in our community, a step towards intergenerational healing. Though I hadn't heard these words before, I felt in my body and soul I was in the right place. After one look at the birth suite, I knew this is where you'd be born. I asked one of the midwives how I could become a patient. The process was simple since the birth center accepted all types of insurance. At my prenatal appointments, my midwife took the time to explain everything, and I felt my decisions were truly my own. We talked about what foods to eat to help you grow strong. With her care, I continued to have a healthy pregnancy. The birth center's other offerings like prenatal massage and Reiki made me feel so nurtured and held. And when the contractions first came, we called our midwife. so excited that it was almost time to hold you. When we got to the birth center, our suite was ready. I labored for many hours, but the freedom to move and the many supports in place, along with the guidance of the midwife and the comfort measures from our doula, eased the pain. Finally, I felt the urge to push, and I felt so powerful bringing you into this world. As dawn broke, the summer solstice of 2023, you uttered your first cry. I held you and your dad cried. My mother and grandmother were with us, and all I could think about was how much I loved you and how much everyone in the room loved us. 4 generations together, rooted in love, and you welcomed with love. You started nursing, then dozed off to sleep. I laid back on the soft pillows next to Dad, and we rested together as a family of 3 for the first time. And you, my love, were the first baby born at the neighborhood birth center, the first of thousands. Your birth meant so much to so many in Boston because together we were remembering what our ancestors had known for generations before us, and we were planting seeds for generations to come. Now in our community, people have a choice about where to give birth. To open our doors and birth the future of Boston, we're raising $3 million. We invite you to join our story.
Thank you so much.
Thank you so much. That was a terrific, terrific video. Our last speaker is Jody Schwartz-Belson. She's also a certified nurse midwife from Outer Cape Health Services. She's the program medical director for Women's Health Services. Welcome, Jody.
Thank you. And thank you for that video, Catherine. That was beautiful. Good evening. Thank you for including me in this panel discussion. I'm Jody Schwartz-Belson. I'm a certified nurse midwife. Throughout my career, I have worked as a midwife at a large teaching hospital, a freestanding birthing center, an in-hospital birth center, a community hospital, and I am currently acting as the medical director of Women's Health Services at Outer Cape Health Services, which is a federally qualified community health center here on Cape Cod. Massachusetts maternal health law, which was signed in August of 2024, is an important step towards creating equity for birthing and postpartum women. It acknowledges the unique role of the midwife and the roles that we play in providing prenatal care, intrapartum care, and postpartum care in a variety of settings. Midwives can work in a variety of settings. We can work alongside other care providers like OBs in hospitals with higher risk, and we can work with lower risk women in homes and in freestanding birth centers. We also can provide care in outpatient settings, such as clinics and home settings. By creating key provisions and definitions of midwifery care, women across the Commonwealth will have greater access to midwives. The law also speaks to insurance coverage of midwifery care. Mass Health now covers midwifery services, as stated by other presenters. This covers prenatal care, which makes care during pregnancy more accessible to women who may develop complications of pregnancy. It will cover labor and delivery service as an increased number of settings, and it also covers postpartum care. Currently, up to 40% of women in the United States do not attend a postpartum visit. This can lead to health complications and disparities in care. The postpartum period is an especially vulnerable time for many women and families. Postpartum depression is the #1 complication of pregnancy. The law speaks to screening for postpartum mood disorders, as well as increasing funding through grant programs for mental health support. The Momnibus law also speaks to collaborative care. As healthcare team members, we all bring unique experiences and expertise to birthing families. The law highlights and validates the importance of birthing and postpartum doula care. It adds lactation consultant licensure to the Governor's Board of Allied Health Profession, which can ensure these important services can be reimbursed, therefore expanding access to women. And it earmarks grant money for health centers to become better equipped to address maternal mental health conditions. I would be remiss if I didn't address the current federal political landscape, which was vastly different from when this bill was signed in August of 24. Healthcare for all is being attacked. This further affects our most vulnerable populations, our families of color, our LGBTQ+ populations, our transgender populations, and all of our women and our children. Currently in Massachusetts, our Black maternal mortality rate is twice that of white women. There will likely be cuts in federal funding to public health and maternal child health, furthering this health inequity. This is a call to action. As residents of Massachusetts, we must band together across all disciplines. We must support each other and the unique roles we play to improve maternal child health. Thank you.
Thank you so much, Jody, and thank you for that call to action for all of us. It's very important. I would like to thank all of the panelists at this time for participating, and I would like to ask all of those in the audience, if you have questions and you have not yet put them in the chat, please do so under the meeting group chat heading, and they will be answered as possible. And at this time, I would like to turn that process over to Sue Cameron. Sue?
Hey, thank you. And just to clarify, the group is actually called Everyone. We don't have a group meeting designation. So anyway, make sure it gets posted to everyone. I actually have about 7 questions. And so that just have come up as a result of the presentations we just heard. I wanted to address the doulas, and Erin and Dr. Eagle had something to say about this. Erin, since Dr. Eagle said that the Cape Cod Healthcare has been a little slow in adopting doulas, but they're going to start doing that. It sounds like we're going to have, need some training and to fill those slots that Dr. Eagle mentioned. And it sounds to me from your description that the background in education to become a doula might be something like a social worker, but I'm not sure. So tell us how you become a doula and what kind of education or skills do you need?
Thank you. So technically, Massachusetts doulas are not regulated. In order to be a mass health doula, you do need to be either a certified doula or follow a process of a lot of recommendations from people that you've already serviced, providers, things of that nature. But I believe in being certified. So in order to be a doula, I would say that you'd have to find a certifying organization. The 2 major ones are CAPA and DONA, but there's a lot out there. Most of the certifying organizations, you're either going to do an intensive weekend or an online program where you're going to have, several, maybe 15 to 20 hours of class, we'll say, and then a list of things you need to do, reading books, writing some papers. So it's more of a, I'd say, certificate program that there's different formats out there. But yeah, you don't need to go to college or something that a social worker would do, but I can see where that would be the thinking. And I was, when Dr. Akel mentioned something, I was going to tell him if he wants to email me. Jody has my email. She also has my phone number. Either way is great. I'm happy to answer any questions. Cape Cod Hospital is very welcoming to doulas, but I do think we don't have very many doulas on the Cape that are ethnic. I can think of one woman of color, and I think the rest of us would identify as white, Caucasian. So I think it would be wonderful to add some diversity to that.
Okay, thank you. Dr. Agle, do you have anything to add to this subject?
Yeah, I would just say that where our program is looking for really bilingual doulas and supporting their efforts, as previous speaker described, that they would go through a training program that we would finance. But we're really looking for folks with Portuguese, Spanish, and Haitian Creole language skills as well as English, to be that bridge between kind of the medical model and our patients.
Thank you. I'm going to take a question that's posted here in the chat, which is a subject I was interested in, and that is, how are these birthing centers going to be funded? Melissa writes, one provision of the bill is that it will establish a new grant program to address perinatal mental health. Can someone please speak more specifically about that? How does the grant program work? What does it provide for, and will it increase access? And who was it? Somebody, I think it was, sorry, I have to look at my notes, somebody who said about raising $3 million in order to build this birthing center. Is there public funding that's going to help implement all these aspects of the law? Who can speak on that? As our senators?
Catherine, before you go,
Catherine.
I have to leave, so I want to add one piece because I want to talk about the public investments we've made in FY24 and FY25. Two things we did in the legislature is we created, particularly in the Senate, a maternal health fund. And that fund partially was used to create and build birth centers across the Commonwealth. There is only one at the moment. In Northampton, Massachusetts. There is none in the eastern part of the state. In the last 2 to 4 years, we've lost Cambridge and Peabody, Danvers area. And so we actually need to build more birth centers. And the goal is to build one in every region of the Commonwealth, because if you cannot get to the place to give birth safely within 30 minutes or less, where you're actually probably living in a maternity desert. And that's one thing that the governor and I haven't agreed on, is I actually think most of Massachusetts is in that space, and we need to do something about that. So we put aside $1 million each year for this maternal health fund. What's great about it is that the birth centers, and we also put about 150,000, I think, for birth sisters in Northampton to make sure that they had monies to operate. But the other half of the money will actually go to small community-based organizations, because what we found, and I'll just speak about Boston, is that there's a lot of organizations working in the field of improving maternal health that do not have access to the great grant writers. I can think of an organization called Proper City that's working on supporting those that have had pregnancy and infant loss, which is a very small ethnic organization in my community. So I'll let Catherine talk about the amount of money that is taken to build the neighborhood birth center. But what's been great is we've been able to at least give $500,000 per year to that birth center. So I actually think it's a public-private partnership that is needed to successfully build anything in the Commonwealth, but particularly birth centers. So good evening, y'all. Thank you for inviting me.
Thank you for those comments, Senator Miranda.
Thank you, Senator. Yeah, as Senator Miranda said, I mean, so last year there was $1.65 million state money allocated towards freestanding birth centers. That is the biggest state investment ever. So that is, and there was a huge amount of advocacy with Senator Miranda being a huge lead on that, and Senator Lovely up in the North Shore. It is fantastic. It's a fantastic start, but it is also like a drop in the bucket of what is going to be needed to really do this. So the other thing is what we need to undo. What has happened historically with birth centers, it is, you were talking about like truly the self-sacrifice of individual midwives. You have midwives taking second mortgages out in their home, you have midwives forgoing salaries to open birth centers. And so part of why and ostensibly when you think about who's going to have even a home to leverage, you're going to, like, you get a very racially skewed sense of like who's going to be opening birth centers. So part of why Neighborhood Birth Center is a nonprofit, which is actually pretty rare for birth centers, is so that we could raise philanthropically. So we've had a huge amount of like individual donors, grant donors, but it has been Herculean to raise that much money. And so a lot of what we're kind of in, we're feeling so much progress and so hopeful for is that there's like a recognition that there needs to be state and federal investment in this. It can't just come from us doing like, baby shower fundraisers in the backyard. To the perinatal mental health piece, I wonder if Dr. Giap would also speak to this. So it wasn't, it's been, the fund has been created, but it wasn't allocated any money for it last year. I apologize. I have a 5-year-old that's being like a lunatic in the window behind me.
It's okay.
But there's advocacy right now with the Minding the Gap Coalition. I'll drop the link in the chat to fund it, to put the funding together so that they can start to allocate like grant money to different perinatal organizations.
Okay, thank you. And Dr. Jupp just came back in. Did you want to comment on what Catherine said?
I only have one comment in terms of funding that was provided by the department to 3 different sites, which include the Roxbury site, the Northampton Florence site, and Worcester for to support or open birth centers. And I think part of that is because that was the extent of the funding we had. It's not like we had any funding attached to most of these bills. So we did what we could to support at least 3. Yeah, that's all I can add.
Can I ask you a question, Dr. Diop? Is that I think you said that home visits are somehow in the bill or somehow specified for certain geographic areas. Did I catch that right? And if so, are those the areas where we have high populations of immigrants or people of color or poverty?
So what I said is that currently there are only 5 sites, and the bill is asking for us to expand statewide. So every community will receive that one-time home visiting. The models that are in place right now were federally funded and only in 5 sites. And the bill is requiring that we expand it statewide. But again,
Okay,
there's no funding at this point to do that.
Okay. Somebody is asking a question about birthing in Nantucket, if there's an emergency and how that might be handled. And I believe somebody that, and maybe it was you, Dr. Job, said birth centers on the Cape will be required. Will there be plans for a birth center on the Cape?
So the legislation allows any given community or any community-based organization that has funding to establish a birth center. What we heard during our listening sessions over the last several years was that the way the regulations were written, they did not meet the national standard and did not allow a lot of people to open birth centers. And we were asked to revise the regulations, which we've done now. The regulations were approved at the Public Health Council early in February, and they will be promulgated. But it's not like the Department of Public Health has funding to implement birth centers. The funding that was allocated to the state were divided into 3 communities: Roxbury, Worcester, and Northampton.
Okay, thank you so much. We are coming to the close here, and so anybody who asked questions and that didn't get addressed, we will address those separately through emails, I think. So I guess I would just need to turn this back over to Eileen, who can wrap things up for us. Thank you.
Thank you, Sue. There were some other questions, as I said earlier, that we will get back to. But in summary, I believe that today's panel is the beginning of the begun. That what you have done for the community, and because this forum is recorded, it allows us to demonstrate the importance of partnership medical partnerships across the Cape. And it also has the partnerships of all disciplines working together. That's something I know the Cape Cod Health Center has been emphasizing, and I thank you, Dr. Agel. But it's also something that needs further recognition in the community, particularly by women who are pregnant or looking to have a child, or even postnatally that has been emphasized. With that, I want to say, if you have not looked at the H4 999 law that was signed by Governor Healy in August of 24, please do so. And we thank all of you, tremendous panelists. You each covered what needed to be heard and addressed in a succinct manner. And to both Suzanne and to Susan, this was not an easy process to facilitate and keep us on time. Kudos to everybody and to all of our participants. Thank you.
Good night.